Although sickle cell disease affects, from a raw number perspective, uh, a relatively small percentage of a population, that small percentage are greatly impacted uh, by their condition and tend to need a significant amount of healthcare support and often have uh, very poor human outcomes and as well as bear a tremendous amount of healthcare costs. Because as you picked up on in the video, I'm sure that it's chronic episodes of severe pain are common with it, in addition to kind of constant some amount of spikes in painful episodes as well as some amount of chronic pain. Um, Stroke is very common with these folks, and as well as vision problems and other pulmonary circulatory problems. These are folks, because of these things, tend to have a low quality of life as measured by a lot of isolation, very common, and impaired functionality, difficulty performing in a job or performing academically, and to no surprise, have a higher incidence of particularly anxiety and depression. So folks with this condition make for a great opportunity to show the value of not even just behavioral health intervention, but psychosocial intervention and social determinants intervention. And that's exactly what the authors of this article from the Journal of Emergency Nursing set out to do by conducting psychosocial evals for 174 of them, to be exact, over a 14-month period at an emergency room in North Carolina. Sorry about the double word there. So some really staggering numbers about the healthcare needs and treatment needs of people with sickle cell disease. Uh, 64 out of, or I'm sorry, 68.4 out of 100 hospitalizations related to complications related to sickle cell disease. The second behind that, congestive heart failure, is a very distant second at 17.3 out of 100 hospitalizations, at least in 2006. $2.4 billion in healthcare, presumably in 2006 alone. So, and in 2010, the most common reason for readmissions to the hospital within 30 days, accounting for almost a third of all 30-day readmissions. If you recall, this being an increasingly important measure. It's interesting that 2010 was the year this data was collected, because that was the first year of the Affordable Care Act and the beginning of some formal what we call value-based purchasing programs, if you recall from our Affordable Care Act lecture, where CMS is starting to begin to provide both financial incentives as well as strong disincentives around the metric of 30-day readmissions. So just heightens the economic impacts of sickle cell disease and acute care needs, as well as the obvious human impact of these people who suffer a great deal from much more than physical pain. So you might have been a little surprised to read, I kind of was when I first read this article, that there's an actual psychosocial evaluation instrument specifically for folks with sickle cell disease called the ED scans, or Emergency Department Sickle Cell Assessment of Needs and Strength. Uh, so I thought you might be interested to look at that assessment tool itself. So I have the link here. This was created at Duke University, Duke Health System. So some of the elements in here, uh, anxiety or depression, barriers to getting to outpatient treatment, frequency of outpatient treatment, Things we've talked about in other articles: transportation as a barrier, obtaining prescriptions, be it copays or or actually getting to a pharmacy, right? Uh, and certainly um, trying to navigate uh, a condition like sickle cell disease without insurance must be extremely challenging. And um, someone without insurance with sickle cell disease would almost certainly be in very deep financial straits and likely at some point in their life, uh, without insurance, to have to file for bankruptcy, given the costs associated with treating sickle cell disease over time. So there's another piece of research where social workers were a critical part and actually the ones conducting the psychosocial assessments. And then these were people um, who presented in the emergency room. Um, uh, the vast majority of the time, the primary complaint was a severe pain episode, and most of the time, that pain episode was was due to what we call vascular constriction or vascular occlusive episode. If you're not familiar with this, people report feeling like they're being crushed from within um, as their capillaries constrict and cause this feeling of almost being crushed from within. Um, at least as I've heard other people describe it. Anyway, so they come in a great amount of distress and are provided some initial treatment, and then the social workers come in conduct their psychosocial evaluation. All of these were done face to face and received at least some telephonic follow up, and the some of the themes won't necessarily be a surprise, but getting to either finding or getting to appointments, finding uh, or getting to prescribers and obtaining prescriptions and getting those prescriptions filled, are two of the things, and lots of psychosocial issues. As we've seen in other studies, transportation for folks with sickle cell is the most frequently cited challenge to getting care. And again, things that wouldn't necessarily be a surprise, but I think it's good that the authors set their study up where they could track the kind of specific transportation problems, which include um, having transportation but unable to safely transport themselves. Other barriers, length of time to get an appointment, um, getting pain taken seriously. This is this can be kind of worse today than it was at the time of this study, in that there is it can be argued that there's a bit of overcompensation in terms of healthcare providers being more hesitant to provide pain medication when it is appropriate because of the attention around prescription opioids and overdose and addiction, and lack of appointment reminders. I think I've told you guys before, my patients and my practice love the appointment reminder feature that they have once they're logged into my uh, electronic medical record, and get those automated appointment reminders. They definitely appreciate it. So the authors were also able to drill down on some of the specific social determinant issues related to both insurance covered as well as behavior health related issues of anxiety and depression. So again, things won't necessarily be a surprise to you, but good to have them documented and quantified in the study. So high pays or deductibles. This concept of having insurance but being underinsured is something that's not paid enough attention to, in my opinion, at the most macro level. There's not enough of a discussion around that when healthcare is talked about at the among the presidential candidates. Um, I guess we do hear Bernie talk about it a bit, but I don't know that even then that he really quantifies that we have millions of people who are uninsured, and many of them lost insurance through changes in policies corresponding with the change in administration, but also many more people have are underinsured. And as the most common measure being, now this is purely my opinion, not something stated by Bernie or anybody in in particular. But even if you just measure having a deductible of $1,000 or more without a employer-sponsored HSA program, if you define that alone as underinsured, that is a large, large pool of people who maybe at one glance say, oh, okay, well, they're among the insured. But that underinsurance can feel like, and I'm sure many of you encountered this either yourselves or with clients you worked with, that can feel from a practical standpoint of like being uninsured. If you don't have any coverage until you've hit $1,000, $2,000, $5,000, $10,000, for most of us, that feels pretty much like having no insurance at all. Anyway, uh, enough of that soapbox. Um, Long waits for insurance approvals to obtain prescription medication, particularly pain medication. And I certainly hear more and more of that in the last couple of years, as we talked about in the last slide. This increased kind of some unintended consequence of this increased attention to prescription pain medicine associated overdose and addiction. Again, has diminishing returns for people who have legitimate chronic pain and have a legitimate need for properly prescribed pain medication, and they're not able to get it, or at least it takes longer to get it. Pharmacy's inability to stock the medication. I've definitely heard from my clients, and when I was doing some crisis line work for Priority Partners a few years ago, where people who are, extremely anxious and on the verge of panic over attempting to get their pain medicine, um, and finding out the pharmacy hasn't stocked it, the insurance didn't approve it, or the insurance has discontinued the approval, or the prescriber has discontinued refilling that prescription. I've seen all of these and had to provide or try to provide some crisis level, crisis intervention to people standing in a Walgreens or CVS that thought they were able to get their pain medication and suddenly were told they were not able to. That is definitely not a good scene in my experience. Stigmatization as a drug seeker, making it harder to get your pain medicines, having a bad experience in the emergency room or even in the outpatient provider office. Um, I've had my own, patients in my own practice come back and say, um, I was told in my face, I'm just a drug seeker, or I'm a drug user, when they're trying to get uh, medication for quote unquote legitimate pain conditions. So anyway, some of these other kind of psychosocial causes of anxiety and depression related to sickle cell, conflicts with family members, isolation, the inability to work, perform, perform in an academic program of any kind, even do volunteer work or enjoy in leisure activities, can be significantly impaired, particularly when sickle cell is not being well managed, or they're having, even under proper care management, having exacerbation of pain or a vascular incident. Uh, and certainly people with all types of pain problems, I hear all the time, no one understands what it's like. Um, I hear that all the time from pain patients, including sickle cell pain patients. So that empathy of really trying to connect with them when we don't have that same pain condition ourselves can it's important, very, very important to because it's often a something we can't directly connect with as a personal experience, but critically important that we are able to convey empathy to their pain experience, because they're often told it's all in your head, or it's, or they're not, they're making it up, drug seeking, etc., which can be very deflating and cause make someone feel quite depressed.